going to go through briefly in my practice, how I do things. And OrthoPulse is a standard of care for me. So once again, in my office, if someone doesn't want to use it, I'm actually going to charge them more money because it means more chair time, more visits, more refinements. I build OrthoPulse into my fee. So it's not an a la carte approach. It's 10 minutes per day, 5 minutes on the upper arch, 5 minutes on the lower arch. All my patients get dental monitoring. I only book appointments on demand. So we're not seeing patients on a regular basis because, of course, we can see how things are going. For simple to moderate cases, I start aligner changes every 4 days. If we've got more difficult root movements, then I will move up to 5. I always use the adaptive mode in dental monitoring, so it will adjust their switching rate if there's some issues. And then just if I have an issue where I'm concerned about a class correction for a patient, or we're working on a midline, or we're doing some other things that are a little bit more challenging or difficult, we can set the alarm up on DM so that my coordinator sends me a link to look at the images every 5 aligners. The AI is pretty good, but it does miss a lot of things, especially in the posterior. So I want to visually look at things for some of these more difficult cases to make sure that we're not missing anything. And then I do use active retainers in all my cases without attachments, and I can make more movements without attachments because I'm using OrthoPulse to finish the cases. With retainers, we're having patients use OrthoPulse weekly to enhance that primarily the soft tissue, but also the hard tissue remodeling. And essentially, we're looking for maturation. We're looking for the osteoblastic activity during retention. Just going to recap some of the benefits here. With OrthoPulse, we're increasing the predictability of orthodontic tooth movement, which leads to decreased refinement rate, decreased treatment time, less patient pain, more comfort. And we've got some compliance tracking. We've got some metrics that we can actually look at when the patient comes in or when there's an issue. And I can say, hey, we can't finish your case in the time that we estimated because you're not doing your OrthoPulse, and we're assuming you're not wearing your aligners enough. And then also, another key benefit is we're just seeing less relapse. So all of this basically leads to improved practice efficiency, less chair time, fewer visits, happy patients. They're really, they like that you're taking the time to sort of maximize their treatment comfort. And it's also a differentiator, right? So a lot. I'm in Vancouver. I'm in downtown. Lots of competition. I get a lot of patients who are coming to me because they see the website. They see that we offer faster treatment. Maybe they're getting married. Maybe they're going abroad to school. Lots of reasons. And we're treating primarily adults, so they want to be done sooner. So we found that there's definitely a niche for using acceleration and increasing predictability of treatment.